Hey guys, so a lot of you have asked me about whether or not I get any sleep when I'm on call. And when I'm on OMFS service, we actually take home call. So we get to go home and I sleep and then I come back to the hospital if I get paged. But when you're on surgery, you actually have to be in-house, which means that I have to be at the hospital at all times. And generally speaking, I don't really get a lot of sleep when I am here on call on surgery, but I do still take advantage of the on-call room because even though I'm not getting sleep, like I still want to go and just like take off my shoes at some point, take off my jacket and just kind of like lay down for a minute. And so even if I'm not sleeping, I'll still take advantage of the on-call room. For us, our on-call rooms are like hotel style on-call rooms. So you go and you get a room key in the beginning of the night, and then you get the room for 12 hours. And it's a private room. It gets cleaned out after every use. The best part is there's a computer there, so we get to do our work. I'm actually gonna go check in. It's the beginning of the night, so I try to get it in the beginning of the night. That way, if I find myself with any breaks, I just head over there and sit down, and I'll show you guys what the whole process looks like. Just got my key to my room. We have, I think, 30 on-call rooms because yes, we are a huge hospital, have a ton of residents who are on call. So I just got my key. I'm gonna go find my room and show you what it looks like. Welcome to my fancy crib for the night. This is what a typical on-call room looks like in my hospital. It looks like someone tried to decorate, so I get to reminisce about New York City while sleeping or relaxing. There's usually a twin-size bed here, some clean sheets, pillows. There's a little lamp. And most importantly, when you're in a hospital setting, there is a desk with a computer that has access to our online medical record system, which is actually super, super important because sometimes I just need to quickly hop on, check a patient's vitals, check on their history, chart checks, just make sure that everybody's doing well. And so it's really important to have a phone where I can connect really quickly to the nurses and a computer. And then I'll be able to be here sometimes for just 10 minutes and sometimes for a couple hours. It all depends on how the night goes. And so that's it. That's what a typical on-call room looks like. Nothing fancy, but it gets the job done. Typically, you know, I don't expect to get sleep on a night of surgery call. It's just way too busy and there's way too much going on, but having an on-call room nonetheless for me to like literally just like sit on the bed, stretch out my legs and just kind of get to relax a little bit makes a world of difference. Trust me, you guys, it's like these little things that you get to do when you're just kind of like stressed and overwhelmed that are super important. It's also a private room, so I can just kind of be here quietly by myself, away from a lot of the inpatient rooms. So sometimes when I'm in the residence room, I just can't even focus because of all of the noises that are happening in the hospital. If you've been in the hospital, you know there's always an alarm going off. There's always something that's happening outside. And so sometimes I just need to isolate myself for even 10 minutes. It can do wonders for your mental well-being. I can just come here, do some breathing exercises if I need a moment to kind of reset or just stretch out, or maybe even just FaceTime with family and my fiance in order for me to just kind of like de-stress a little bit. And if I'm lucky and can shut off my eyes for a little bit of time, then sometimes, you know, that is a bonus. But the pager is the most important thing. I keep it right next to me so that as soon as I'm paged, I can get up and typically be within a patient's room in just a few minutes. But but sometimes it's just something that I might need to do on the computer, so I can actually stay here for a little bit longer and just hop on the computer that's in the room, make sure that patients have the right medications and all of that stuff. And so it's definitely, if you have an on-call room, even if you're busy, definitely take advantage of it. It can really change your night shift and the way that your day works. And so I definitely recommend it. This is definitely nothing fancy, and of course I would much rather be at home in my own sheets and my own bed, cuddling Ozzy, my dog, but this is not a bad temporary solution when I'm on night call. So another important room when you're on call is the resident lounge, where we get all of these awesome snacks that really come in handy when you're on call and you're starving. But even more importantly, we get a Keurig machine with lots of coffee, which has literally been one of the things that has saved me time and time again when I'm on call late at night and I'm dying and just need a coffee because I'm so tired. Okay, that's it. All done with my on-call room, and head back to the workroom now. All right, so back in the residence room, it's the middle of the night, and of course I didn't get very much sleep, but I like to come back to the residence room when I want to be close to patients and check on them. I got a couple of pages and want to just kind of round quickly before I start getting ready to prep the list for sign out. If you're a little bit confused about what it is like to be on call, don't forget to check out my other vlogs about being on call. When you're on surgery, you actually just work a shift, so I do about 12 to 13 hours and then I go home. That's why you have to be here in the hospital. So I actually get to go home and sleep. When you're on OMFS and you do house call, your call is a lot longer because you get to go home and take call from home. And so I do have a video on being in-house call on trauma surgery and being on a longer 36-hour call with OMFS. Don't forget to check out those videos. And speaking of other videos, subscribe to my channel, you guys, because you'll be the first to know when a new video drops. And don't forget to like and comment below. Let me know what other content you want to see. Hope you guys enjoyed it. And I am going to get my work done so I can get out of here and go home and sleep. Have a good day, you guys.